I've been a filmmaker for most of my adult life. It's really hard work. It's a very, very long day. I think every filmmaker lives for that moment when, during that tough day, the thing that you've been waiting for so long actually happens. That's the shot I came for, and you've done your job. About in my mid-50s, I noticed something after going swimming, this strange rash on my chest that I couldn't identify. So I decided I'd talk to my dermatologist and see what he thought. And he said, well, you know, that just looks like atopic dermatitis. And he prescribed moisturizing and sometimes use of steroid creams. So over the years, this strange rash did start to get worse. It spread to other parts of my body. About 11 years after this progression of this rash, I had a tremendous skin flare where it all turned a bright pink, became very painful, and eventually it started to actually exfoliate, just to peel off, as if you had a really bad sunburn. It started to get really very itchy too. And at night, often I'd wake my wife up and say, can you just rub my back because I'm going crazy. So when I went to see my dermatologist, he was a little puzzled by what was going on. He pulled in all the other doctors and nurses, and he said, here's what Jeffrey's condition is, here's what's going on. Any ideas? Well, there was one doctor, and she said, you know, I think we should do a biopsy because it could be a form of cancer. And 2 days later, they called me and said what I had was a very rare form of cancer. It's called Sézary Syndrome, and it's a cutaneous T-cell lymphoma, or CTCL. And it was scary. So the first course of treatment that the doctors were going to recommend to me was a retinoid and a photopheresis treatment. Now they would measure the T-cell levels in my blood, and they were coming down, but just excruciatingly slowly. And I wasn't really feeling better. My numbers had started at around 8,000, and it sort of plateaued about 600. And we couldn't seem to get it under that. My first introduction to POTELIGEO was through some chat groups on the internet. My doctors discussed some of the risks and benefits of using POTELIGEO, and I felt confident that it was going to be a good direction for me. I was willing to go that way. During the infusion, the nurses were on the lookout for any side effects that might occur. I started to notice a difference in my skin in about a month after the first treatment. The redness continued to fade in the course of about 9 months. The last time I had a blood test, it showed that my T-cell count was 0, undetectable, which showed that I was responding well to the medication. I just took a deep breath and felt so much better for the first time in a long, long time. This is my experience, and it could be different for other people. You know, I just want people to feel from my story that there really are options out there that can make a difference for them, because they certainly did for me. In the depths of the worst of my cancer, I was convinced that I would really never achieve what I wanted to in my work. All the goals that I had set for myself were just out of reach, and the time was ticking, and it was going to run out before I could ever do that. And when I was able to feel better, it gave me back that possibility that there was a happy ending to the story.
POTELIGEO is a prescription medicine used to treat Mycosis fungoides, MF, or Sézary Syndrome, SS, in adults who have tried at least one prior medicine taken by mouth or injection that did not work, or in whom the disease has come back. POTELIGEO may cause serious side effects that can be severe or life-threatening, including skin problems, infusion reactions, infections, autoimmune problems, and complications from stem cell transplant. Call or see your healthcare provider right away if you develop any symptoms of the following problems or if these symptoms get worse. Skin problems. Signs and symptoms of skin reactions may include skin pain, itching, skin blistering or peeling, rash, painful sores or ulcers in your mouth, nose, throat, or genital area. Infusion reactions. Signs and symptoms of infusion reactions may include chills or shaking, redness on your face, flushing, itching or rash, shortness of breath, coughing or wheezing, dizziness, feeling like passing out, tiredness, fever. Infections. Signs and symptoms of infection may include fever, sweats or chills, nausea, flu-like symptoms, sore throat or difficulty swallowing, shortness of breath, diarrhea or stomach pain, cough. Autoimmune problems. Some people receiving POTELIGEO may develop autoimmune problems, and some people who already have an autoimmune disease may get worse during treatment with POTELIGEO. Complications of stem cell transplant. Patients who receive a stem cell transplant using donor stem cells, allogeneic, after treatment with POTELIGEO may experience complications that can be severe and lead to death. Your healthcare provider will monitor you for signs of complications if you have an allogeneic stem cell transplant. The most common side effects of POTELIGEO include rash, tiredness, diarrhea, muscle and bone pain, and upper respiratory tract infection. Before starting POTELIGEO treatment, tell your doctor about all your medical conditions, including whether you have had a severe skin reaction after receiving POTELIGEO, have had an infusion reaction during or after receiving POTELIGEO, have or have had liver problems including hepatitis B, HBV infection, have a history of autoimmune problems, have undergone or plan to have a stem cell transplant using cells from a donor, have lung or breathing problems, are pregnant or plan to become pregnant. It is not known if POTELIGEO will harm your unborn baby, are breastfeeding or plan to breastfeed. Talk to your healthcare provider about the best way to feed your baby during treatment with POTELIGEO. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You are encouraged to report suspected adverse reactions to Kyowa Kirin Inc. at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.